Hello, my name's Jason. I'm the charge nurse on Ward 6. I'm here to talk to you about a new exciting project. We want to involve patients being a second checker and helping the delivery of their antibiotics.
Patient empowered to second check drugs. The aims of the new way of working are increase direct patient contact time, improve efficiency, and maintain independence by allowing patients to check their antibiotics with a single nurse. The nurse takes the trolley with the medication and all the medical equipment required to prepare the prescribed drug in the patient's room. The nurse goes through the procedure with the patient to clearly explain what will happen and obtain their consent. The patient signs the form to consent to become a second checker of their own IV drug, and laughing uncontrollably may be a side effect. The trolley is thoroughly cleaned and all the equipment needed is arranged correctly. The nurse explains how the patient can log on to eMeds using the iPad in order to see which IV drug has been prescribed for them. The nurse and the patient check together that the drug they have is the same as the one prescribed, its expiry date, and that it's the correct dose. The patient enters their details into eMeds, while the nurse prepares the medication sticker used to identify the prescribed drug. The nurse washes their hands, and gloves and an apron are worn whilst preparing the drug in front of the patient. The patient can then validate the drugs that were prepared, as a second nurse would in the old way of working. The nurse hangs the drug on the stand in the normal way, and the rate is checked with the patient. The drug pump is set and the drug is attached to the patient. The nurse will then seek confirmation from the patient before starting the infusion of the drug.
Happy with me to start?
Yeah.
Then high-fives the patient. The patient will be responsible for the following: confirming that they are the right person and it is their medication chart they are looking at, the expiry date of the medication, their allergy status, that the correct medication and dose is being prepared, that it is the correct time to administer the medication, that the correct diluent is being used to reconstitute the drug, that the duration of infusion for the medication is correct.
I found it to be a really positive experience. Obviously when you come into hospital you're needing that extra care and different IV drugs and things to keep you well. But I love the fact that I maintain some sense of independence when I'm getting to be second checker. I like the relationship that I build up with the nurses as well through that time that we have. So I found it really positive. It has changed the way that I interact with the nursing team. I get more face-to-face time with them now, which I really like. When I'm doing second checking, there's opportunity and a bit of space alongside doing the checking for conversation, for finding out how they are, getting to talk a bit about how my life is at the moment, and I really appreciate that, particularly when you're in this room for 2 or 3 weeks and not being able to go out very often. Actually, the people who come in make a real impact on your life, so that time is really precious. I was intrigued when I heard about the process for the first time. It was back in August last summer, which was 2017, and I was really up for having a go. I did have some reservations about if I wasn't feeling well enough, or I didn't want to make more stress for the nurses, but I was also really excited about the opportunity to be involved and find out how it would be. I found the process positive. It's great to see what the nurses are actually doing when they're drawing up, and how complicated and time consuming it can be for them. But I like that I'm a part of that and I get to see it, and I feel like I'm able to be useful for the nurses as well, as it gives me value in knowing that I'm working alongside them. I would definitely recommend having a go at being a second checker. I think it's a really good opportunity. At any point, if you're not feeling well enough, you don't have to do it, and so that gives you the freedom to rest more if you need to rest more. They don't ask you to do it on the morning run, so you don't need to worry about that. But it's a really good opportunity. It builds relationships, and it gives you a good sense of what it is that is going through your body, and how you can keep as well as possible. So definitely go for it.